Thank you for joining us for our second UAMS Insiders Lunch with Leaders event. I'm Angela Wimmer, Vice Chancellor for Institutional Advancement, and have the pleasure of working alongside UAMS's closest friends, alumni, and donors. As you'll notice, we are staying socially distanced and masked when not speaking on stage, and we hope you're joining us in these efforts to keep Arkansas healthy. These Lunch with Leaders events are designed to keep our closest friends, alumni, and donors connected and informed during this period of social distancing, and we hope you find them helpful. If you've not yet submitted questions, please send any throughout the presentation via email to iaevents@uams.edu or submit via the Facebook live stream. Today we welcome Chancellor Cam Patterson. As most of you know, Dr. Patterson is a renowned cardiologist and healthcare administrator. He became Chancellor on June 1st, 2018, and we've just celebrated his second anniversary. He's here today to share updates from across our statewide system as we strive for a better state of health for all Arkansans. Please welcome Dr. Cam Patterson.
Good morning. It's great to be with you today and have a chance to share some of the exciting and challenging things that are happening here at UAMS. Since March, the majority of our attention has focused on COVID-19. We've had to rethink completely the way that we provide education. We've had to reconfigure our hospital to ensure that we are providing safe and efficient care. And we've had to divert much of our research enterprise to focus on the challenges presented by COVID-19. While COVID-19 affected us, we did not wind down. We stepped up for the people of the state of Arkansas. Over the last few months, we've had to postpone many clinical procedures and surgeries, and for a substantial period of time, for about 2 months, we were actually losing about $1 million a day in revenues because of clinical work that was postponed. We put a pause on hiring, and we have tightly regulated our expenses for the main purpose of avoiding the furloughs and layoffs that have affected most other healthcare systems here in the state of Arkansas. And so far, we have been successful in making sure that we've not had to lose great members of Team UAMS because of COVID-19. We've now reopened our clinics and have brought back non-essential elective surgeries. We're working now almost around the clock to get caught up on a backlog of clinical encounters and surgeries to get caught up and to make sure that people who need access to UAMS continue to have it. Now, in spite of these challenges, we continue to garner recognition both here in the state and nationwide. We were very pleased this week to hear that the U.S. News and World Report has again ranked UAMS the #1 hospital in the state of Arkansas for the second year in a row. In addition to that, our ENT program is ranked top 50 in the country, and we have high-performing clinical programs in lung cancer, colon cancer, COPD, heart failure, and hip and knee replacement, an indication of the stellar performance of our clinical programs across the board. In addition to the U.S. News and World Report recognition, Arkansas Times recently ranked UAMS the #1 place to work in the state of Arkansas. That says so much about Team UAMS and the great opportunities here for personal growth and for job satisfaction. We continue to receive accolades in other areas as well. The American Heart Association and the American Stroke Association recently ranked UAMS as a Gold Plus Award winner for stroke outcomes here at UAMS. And our team members, 10,000 strong, working in 73 out of the 75 counties in the state of Arkansas, continue to do so much that provide us opportunities to brag on them. Now, since the COVID-19 pandemic hit the United States, we've obviously had to substantially change the way in which we have delivered care. We stepped up to the plate and provided on-site rapid turnaround genomic testing to diagnose COVID-19. And to this date, UAMS does about 10% of all of the COVID-19 testing, diagnostic testing here in the state of Arkansas. And we are consistently recognized as the place to go to for rapid turnaround testing for COVID-19. We've developed almost overnight a drive-through triage service here at our Little Rock campus. We regularly provide testing for up to 500 individuals a day, and to date we've done about 36,000 screens and tests through our drive-through triage unit, which I know many of you and your family members have accessed. And we've consistently heard great things about the service that's provided there. But some people can't come to Little Rock, and so we created a mobile testing unit that goes across the state, especially to underserved areas, to provide testing for vulnerable populations and to help the Arkansas Department of Health determine where the new hotspots are here in the state of Arkansas. And I was pleased to see this morning that we now have a new mobile van that assists in our mobile testing services. This van was provided by a generous grant from our partners at Arkansas Blue Cross and Blue Shield, the Blue and You Foundation. And this van will allow us to continue to go across Arkansas to provide mobile testing for communities that don't have the resources themselves to provide those testing services. In addition, our Northwest Arkansas campus of UAMS, through the good work of Dr. Pearl McElfish, who's the Vice Chancellor of the Northwest Arkansas campus, and Dr. Sheldon Ricklin, have been focusing on the healthcare needs of the Marshallese population here in the state of Arkansas. And to put that in perspective, the Marshallese make up 0.4% of our population here in the state of Arkansas, but they account for almost 10% of the total deaths due to COVID-19. So working with that community to identify ways in which COVID-19 is transmitted, how we can prevent transmission and make sure that we maintain a healthy Marshallese population is critically important to us. In addition, our Division of Diversity, Equity, and Inclusion, working with our Northwest Arkansas campus and our regional campuses, has been focused on other vulnerable populations. And we know that minority populations, African American and Latino populations are particularly vulnerable to adverse outcomes related to COVID-19. And we're working very closely with those populations, those communities, to find ways in which we can prevent infection and mitigate the impact of COVID-19. Behind the scenes, we have mobilized our emergency operations unit, which helps us centrally manage all of our resources as we devote our time and effort to mitigating the impact of COVID-19 across the state of Arkansas. Here at our medical center, we have repurposed inpatient units to create a 120-bed negative airflow COVID-19 unit in case we have an accelerated impact of COVID-19 here in Arkansas. We created a 144-bed ICU surge capacity if that is needed for people in the state who require intensive care unit services. At any one time, we have about 300 of our employees and students in quarantine because of COVID-19 exposure or infection. And our team has made sure that those individuals are checked on regularly for wellness checks, and we provide meal availability for them. We've redeployed literally hundreds of our UAMS team members from areas where they are less acutely needed to areas in which they are more acutely needed. We've created a contact tracing center that collaborates with the Arkansas Department of Health. That's located in our College of Public Health. And in collaboration with the Little Rock School District, we've opened up a day camp this summer to allow our employees with young children to have daycare services so that they can continue to work here and provide care for people who need their services. In terms of planning for the future, our College of Public Health has been providing biweekly updates of projections for the COVID-19 pandemic. Earlier this month, they projected that by the end of August, or by the beginning of August, we would have 40,000 total cases in the state of Arkansas. And as we end up the month of July, that projection turns out to be almost perfectly correct, unfortunately. The long-term projections from our College of Public Health indicate that by November, we're likely to have over 100,000 active infections in the state of Arkansas. That's about 7 or 8 times the current number of active infections that we have. So a substantial increase is projected. And it's because of those projections that and the advocacy that has occurred here at UAMS that Governor Hutchinson, with our strong support, has issued a statewide mask mandate. And as we're now 2 weeks into that mask mandate, we're hoping that the renewed projections from our College of Public Health indicate that the curve will flatten and that we'll see less of an impact on that. Look for those updated projections next Tuesday. We continue to provide virtual services for people who have urgent care needs through UAMS Health Now. Many of you have accessed the site for urgent care needs. We've expanded our digital services across the spectrum of the clinical programs that we have, including expanding mental health digital services through the Psychiatric Research Institute here at UAMS for much needed behavioral health services in this time of high stress across the state of Arkansas. We've opened up a COVID-19 respiratory clinic so that we can keep people with respiratory symptoms separated from the rest of our clinical enterprise. And Provost Stephanie Gardner has been working with the deans of our various colleges to come up with plans for continuing education in the fall in the safest possible way for our students and for our teachers. And it will, in many cases, be a combination of in-person and virtual remote educational programs to allow UAMS to continue to provide the educational needs for healthcare in the state of Arkansas, but also to make sure that we do this in a safe and effective way. Now, all this is occurring while we still have other needs that we continue to address, and UAMS continues to march forward. I was really excited to announce to our Board of Trustees for the University of Arkansas system a couple of weeks ago that in collaboration with our close partners, Arkansas Children's Hospital and Baptist Health, UAMS will be opening the state's first proton beam therapy center for treatment of patients with cancer. There are about 40 proton beam centers across the country. This will be the first one in Arkansas, and it will ensure that people with advanced cancer that will be sensitive to proton beam therapy who live in Arkansas won't have to leave the state of Arkansas to get these services. In August, we'll be opening up our new Women's Health Center here in Little Rock. This will be an opportunity for us to co-localize all of our women's health services into a beautiful outpatient, easily accessible facility here in Little Rock. We will be opening up a new regional program soon in El Dorado, and we're very excited about that collaboration with the Medical Center of El Dorado. And we continue to expand the services that we provide in Northwest Arkansas. Our most recent expansion is orthopedic services in Northwest Arkansas, and that has gotten off to a robust start. A lot has been going on, and I could say that the team spirit here at UAMS has been exceptional. We've seen that across the board, from our frontline caregivers, our nurses and doctors, to the people behind the scenes, the people who make things happen in environmental services, our IT teams, everyone is really pulled together in what otherwise would be a very difficult moment. But we couldn't do that without your support as well. And it always feels good to our team when they can hear that people in the community like you, people who have been part of the UAMS family for a long time, are sending well wishes, sending good thoughts, and providing us with those small things that help to make sure that it's easier to get through the day. We frequently get gifts of lunches, meals that come from you, people in the community. The state legislature last week, every day, brought meals to our team that's working in our mobile triage unit. Those things mean so much. And on behalf of the entire Team UAMS, we want to thank you for the role that you have played in making sure that our team has the momentum, the enthusiasm, and the support to move forward. So thank you very much for that. Appreciate the opportunity of filling you in for a few minutes on what is going on here, but I think the most productive use of this hour is going to be hearing from you. Welcome any thoughts or comments that you have, and certainly we welcome any questions that you have, and I will do the best that I can to answer the questions that you have. If I can't come up with an answer right now, we'll make sure that we get back to you with the information that you need so that you understand what we have going on here at UAMS. So, Angela, are there any questions?
There are. So the first one you touched on regarding minority and ethnic groups and the role of UAMS in helping to alleviate that disparity. But the question is, can telemedicine or telehealth play a role in helping with that problem?
Telemedicine and telehealth play a big role and a necessary role. And let's put this into perspective. We talked a little bit about the Marshallese population. Well, there are actually very few people outside of the Marshallese population themselves who speak that language. So, having interpretive services can tap into the digital programs that we set up through the UAMS Institute for Digital Health and Innovation. Similarly, many of the minority and underserved populations here in the state are in areas where there's not ready access to health care. And so the Institute of Digital Health and Innovation is a great tool for us to reach into these communities, to establish trust, to provide access to care, and to make sure that we are providing everyone, wherever you live, whatever your zip code is in the state of Arkansas, with the resources and support that you need to address not just COVID-19, but all the health challenges that we face here in the state.
Great. So we keep hearing about the double impact of COVID-19 and the flu this fall.
Yeah.
So this question says, is it because people do not want to go out in public and get a flu shot, or the distrust some people have with science right now? What do we think is going to make that worse?
Well, this is a unique challenge because, first, we've never experienced COVID-19 before, so we have many people who have never been exposed to it. We, as healthcare professionals, don't fully understand everything that we need to know about the virus, and so we're still learning. And then this is a situation in which we have other diseases that phenocopy or mimic many of the symptoms of COVID-19. And you mentioned the flu, the common cold. Now, those are seasonal challenges that we face. Right now, it's not that difficult clinically to discriminate somebody who has COVID-19 from a normal person. But come the fall, when the cold and flu season does begin to hit us, it will be less and less clear whether somebody has COVID-19, whether they have regular flu, whether they have the common cold. And that's going to create a challenge. So I think the point about getting your flu shot is super important. It's more important this year, I think, than it has ever been. There's no reason not to get a flu shot this year, as long as you don't have a contraindication. It's probably more important this year than ever. So go ahead and make plans to get your flu shot as early in the season as you can to protect yourself against that. Now, there is a silver lining to all this, and that silver lining is that the same things that we are doing now to prevent COVID-19 transmission, masking, and you can get one of these wonderful UAMS masks at our gift shop now, masking, social distancing, and good hand hygiene. Those three things are going to protect you against colds and flu as well this year. So knock on wood, maybe because of what we're doing for COVID-19, we'll have less of an impact on the cold and flu season. But I think that it goes without saying that COVID-19 is going to be with us throughout the winter, and it's unlikely that we will see a substantial abatement in COVID-19 and any ability to substantially draw back from what we are doing with respect to masking, social distancing, and hand hygiene until well into the spring or summer at the earliest of next year.
So as the largest statewide health facility, how worried is UAMS that people who need health care for heart disease, lung disease, and cancer are avoiding seeking health care because of COVID-19?
We are worried about that, and in fact, UAMS is about to embark on an ad campaign to make sure that people know that we are open for business, and that this is not a time to neglect your other healthcare needs. There have been reports of delays in accessing healthcare and the adverse implications of that, not just for adults but also for children. And I can tell you, because we have put a substantial amount of work into this, that we have created as safe an environment as one can possibly imagine for patients with problems that are not related to COVID-19, so that people can come here and get their regularly scheduled colonoscopies, can check with their cardiologists if they feel like they're having cardiac symptoms, can address child health needs to make sure that problems or needs like vaccinations, et cetera, are not deferred. So I would encourage everyone to send out the message that UAMS can provide health care across the spectrum, including elective surgeries, in a safe way, that we've created as safe an environment as you can possibly imagine, that we have ensured that our patients are not put in harm's way when they're here. And for each of you individually who are participating in this conference, I'd encourage you to think about your own healthcare needs and to make sure that you're not in any way neglecting your other healthcare challenges just because we have COVID-19 in the state of Arkansas.
So the next question, it sounds like we may have an expectant mother in the crowd today. It says, with the changing environment, how has UAMS changed its protocol in delivering health care for expectant mothers and the delivery of babies? And will any of these changes continue after the pandemic is controlled?
Well, I think the last comment is applicable to everything that we do. There are so many things that we have done to modify our healthcare delivery that are going to persist going forward. I mentioned the large expansion of our digital health footprint. Virtual visits are here to stay. People have gotten comfortable with them. They've appreciated the convenience of virtual visits. And I see virtual visits as something that once we have dealt with COVID-19, we'll continue to utilize. We'll find many aspects of what we do across the spectrum of our healthcare that will persist after this happens. We'll never manage respiratory infections the same way, even if COVID-19 is completely negated as a challenge for us. Now, in terms of expectant mothers, whether it's you, whether it's somebody in your family, whether you might have a grandchild on the way, we've done a lot to make sure that both our expectant moms and the new babies that we bring into the world here at UAMS and family members are kept safe. Some of these are things that make sense. We test every expectant mother so that we know if someone is COVID-19 or positive or not before they come to the delivery room. That's both to keep the baby and family members safe, but it's also to make sure that our healthcare providers are safe, and we certainly don't want one mom giving COVID-19 to another mom. I'm glad that that has never happened here. We've had restrictions in visitors to expectant moms, and that's a big challenge. We roll back on some of those restrictions to make sure that family members have access to participate in one of the most important events that a family can have. But it's not a free-for-all, and that comes with some inconveniences that we understand and work as hard as we can to address. And you'll find if you are about to have a new family member brought in, that everyone's a little bit more careful, that we maintain social distancing as much as we can, but that we still provide the great UAMS level care that you've come to expect.
Great. So how has COVID-19 impacted the College of Public Health, and how do you see the enrollment and job opportunities in the future of public health?
Well, that's a great question. The Bozeman College of Public Health is a real gem here for the people of the state of Arkansas, and we've been so pleased with the work that our still relatively new Dean, Mark Williams, and his team members have always done to address public health issues here in the state. But I think, if there's a handful of silver linings to the situation that we're dealing with now, one of them is that it has made absolutely crystal clear the importance of public health education, public health policy, and public health research is for people here in the state of Arkansas. And I think almost everybody in the state now knows about our College of Public Health, the role that our College of Public Health is playing in terms of informing the governor and our legislators about the challenges of COVID-19, making predictions about where this is headed in the future, how we can mitigate the impact of COVID-19, and those things that we can do to identify at-risk populations and ensure that they are getting their healthcare needs. And an example of that, our College of Public Health has done research on those populations that are most afraid of things like going back to school, challenges that the communities face in terms of needs for kids in an environment where school activities are restricted, identifying populations that are most at risk for adverse consequences, sequelae of COVID-19, and looking at ways in which those can be mitigated. So I expect that one of the impacts of COVID-19 that we will see is an increase in the number of enrollees into our public health programs as people now appreciate the rewarding career that you can have by really making a difference through an impact on public health.
So this next question is perfect follow-up to that. How are colleges preparing to teach students? Virtual, in person? How's that going to look this year?
All of the above, for sure. One thing that we can't do is we cannot roll back on our educational mission here at UAMS. UAMS educates the majority of physicians in the state, the majority of healthcare professionals in the state. About 70% of the healthcare professionals who practice here in the state of Arkansas were trained at UAMS. And because we are still a substantially underserved state with respect to healthcare services, we need to accelerate the training that we do, not roll it back. Now, we still need to do this in a way that it is safe for students and safe for our teachers, so that our professors are comfortable that as they continue to do that which they love to do, that they're able to do that in a safe way. We have substantially moved a large portion of our educational platform onto virtual platforms using Zoom meetings and other means of doing this. When we need to convene, we do that in ways that are safe for everyone involved, maintaining social distancing, everyone wearing a mask in the classroom. And there are some things that we do that simply require our learners, our trainees, to be physically present. You know, if you're teaching someone how to do a procedure, that's got to be done in an in-person setting. So that's never going to go away. But we have to make sure that we do that in a way that is safe for everybody involved. And our Provost Stephanie Gardner, working with the deans of the various colleges, has come up with what I think is a very thoughtful plan to allow us to bring our trainees back on campus in the fall with minimal to no risk to anybody involved.
So this next question may have come in before you brought this up, because I know you talked about our exciting news for proton therapy.
It again.
Well, and it says, can you share details? So maybe is there a timeline or anything else you'd like to share about that?
Yeah. So the Proton Beam Center will go to the University of Arkansas System Board for approval at the next board meeting. The board members have already expressed enthusiasm about this project. We have an outside partner, Proton International, which is the national leader for building proton beam centers, who will be the partner with UAMS, Arkansas Children's, and Baptist Health in bringing the center to fruition. The center will be located in a new radiation oncology building that we will be constructing on the east side of our Little Rock campus. We don't have a timeline yet because we don't have formal board approval for this, but we anticipate moving forward as quickly as possible to get this center built, because there's such a big need for it. You know, children with many forms of cancer are candidates for proton beam therapy, which is why our partner, Arkansas Children's Hospital, is on board with us. Problems like prostate cancer are great great opportunities for us to use proton beam therapy as a way to mitigate the negative adverse impacts of radiation therapy and still providing a safe, clean cure for patients with that form of cancer. And there are a number of other forms of cancer in which proton beam therapy is indicated. In addition to that, I think it's important to say that having proton beam therapy available here is going to be important for our National Cancer Institute designation application. It will demonstrate our commitment to cancer care and cancer research, and will allow us to do clinical trials in which proton beam therapy is a component of the clinical research that's being done. So this will be a big, important, positive part of our application for NCI designation. And the work that Dr. Mike Beer, who's the director of the Winthrop P. Rockefeller Cancer Institute, the team there, many people who he's recruited already to come to UAMS, they're all marching forward very rapidly. So I'm looking forward to the opportunity to continue to share good news to everybody about the goal of attaining National Cancer Institute designation for the University of Arkansas for Medical Sciences to be the first NCI-designated cancer center here in the state of Arkansas.
I love this question because I know we're doing a lot in this area, but what research is UAMS conducting on COVID-19 to help understand and control coronavirus?
Oh, a lot, you know, and the team has done so much, from cutting-edge research looking at stored convalescent plasma to treat patients who are acutely infected with COVID-19, work done looking at the structure of COVID-19 to help understand how we can develop better antibodies and tests to measure the prevalence of COVID-19. looking at structure to predict drugs that would help to treat patients with COVID-19. You may have heard that Governor Hutchinson gave UAMS $3.3 million to do a serosurveillance study of COVID-19 across the state of Arkansas. And that's something worth saying a little bit about. So we developed high-throughput tools to measure the presence of COVID-19 antibodies quantitatively. So we know not just whether or not antibodies are present, but how high the titer of viruses is, and looking across the state at all age groups, including children, so that we can understand which counties, which communities have had a high or low impact of COVID-19 since this pandemic has begun. We'll be looking at some populations over time to see how antibody titers change. This will help us to understand whether immunity to COVID-19 is long-lasting. It will prepare us for a world in which an eventual COVID-19 vaccine is available, and it will allow Governor Hutchinson, the state legislature, local communities to understand the impact that COVID-19 has already had in their communities as we begin to think about things like bringing kids back to school in the fall. So this is really cutting-edge, exciting work that's being done, and we'll be having some conversations actually this afternoon about UAMS participating in the vaccine studies for COVID-19 as well. So much exciting work is being done. And think about this, all these research programs that I told you about, which are really just the tip of the iceberg of what we're doing here, didn't even exist 6 months ago. So it shows you how rapidly UAMS and our teams of scientists can transform themselves to address the needs of people here in the state of Arkansas.
So this is a great follow-up question to that one. Are we corroborating research with any other medical facilities around the country?
Absolutely, not just around the country, or around the world. So our team members are collaborating in antibody development and working on new drug therapies, both with academic partners around the world and also with drug companies and the private world, in order to come up with better ways to understand the virus, how we can mitigate the effects of the virus and to treat the virus. So we're part of a very prestigious, elite international team addressing COVID-19 issues across the state. And people look to us for our expertise, especially our expertise in rural health. There are very few places in the U.S. that have an understanding of rural health care needs the way that UAMS does. And so people reach out to us for our expertise to be parts of teams that are addressing this challenge, both here in the United States and internationally.
Now, we've heard a lot about this in the news. So this question says, does UAMS have access to a consistent supply of Remdesivir, and what has been the success of the drug?
We do have access to Remdesivir. The Department of Health, the Arkansas Department of Health, has been distributing this drug, and some of those distributions have come to UAMS because of the large number of patients that we treat. We've seen some success not in everyone. It's not a cure, but it does mitigate the effects in patients who are severely ill, especially patients who require intensive care unit management, patients who are on ventilators. And so we use it. We're pleased with the results. We think that there are opportunities for better therapies, and obviously what we really need is a vaccine or cure.
So I've not heard this, but this question says, at one time there was a discussion to create a separate facility with collaboration of other hospitals to treat COVID patients away from current hospitals. What is your opinion of this approach?
Well, that's a great question. So, how will we manage things if we have not 30 patients in the hospital with COVID-19, but 300 patients in the hospital with COVID-19? We've worked closely with Governor Hutchinson, with the Arkansas Department of Health, to come up with strategies to manage this. The fact of the matter is that having a field hospital or one single place to manage COVID-19 is difficult to pull off, and New York is an example of this. They created a field hospital, and I don't think that they ever treated, they certainly treated fewer than 100 patients the entire time that field hospital was up and running. it's hard to create a single place that provides all the resources that intensely ill patients with COVID-19 can manifest. And the best place is still a hospital that's been in existence and has all those resources already available to it. Now, we are collaborating with our partners across the state. When Washington Regional and Mercy Hospital were being severely impacted, when Northwest Arkansas was a hotspot, we worked closely with the CEOs of those hospitals to make sure that if they needed resources from us, that we were available. We are always, on a daily basis, taking patients from within Arkansas at hospitals that don't have the capacity to manage very ill COVID-19 patients themselves. And frankly, we frequently get approached by hospitals outside of the state of Arkansas because they know that we have impressive capabilities that aren't available in other states in our region. So I think that the best way that we can manage the need for capacity for COVID-19 patients is to look at the way that we provide services and to come up with surge plans. I mentioned our surge plan here briefly. We've created a 120-bed inpatient unit for low acuity COVID-19 patients here, and we haven't had to implement the utilization of that unit yet, but that's available to us, and we can surge to provide that capacity. We've created a surge capacity to add 100 additional COVID-19 ICU beds if we need additional capacity for very sick patients with COVID-19. And I think that unless things get extremely challenging, the best way for us to manage is for the hospitals to continue to collaborate so that we know who has resources that are needed in one place and not in another, and that we make sure that we match resources with where the patient needs are. But that for the most part, I suspect that we will manage the majority, if not all, of COVID-19 positive patients who require hospitalization in our existing healthcare facilities.
That wraps up our questions. So I want to thank you for being with us today.
Well, that was exciting. The questions were great.
Yes.
I'm glad that we got a chance to share some of this information about what is going on at UAMS. And I would say we continue to, appreciate everybody's support.
Yes, and thank you all for joining us today and sending in these excellent questions. For anyone who is interested in the proton therapy, next month we will have Dr. Michael Beer joining us. He is the director of the Winthrop P. Rockefeller Cancer Institute. So I'm sure we will have lots of exciting information about that new program when he's with us, and you can send in your questions again next month. We will be having these each month, so we'd love for you to send in suggestions for topics that you'd like to see and continue to send in your questions as we have these. But thank you for joining us today, and we look forward to seeing you again next month.